And many of you might be wondering when you should go to the hospital if you are suffering from a heat-related illness, especially in the age of coronavirus. Our David Caltabiano joins us live in Phoenix. David, what did the doctor tell you today?
Whitney, he says if your body temperature just isn't going down, then you really don't have a choice but to go to the hospital.
Some people develop change in mental status or acting, abnormal. That's definitely a sign that things are going bad.
Banner Health's Dr. Frank Lavecchio says don't hesitate to call 911 if you're experiencing or see symptoms of a heat stroke, dizziness, slurred speech, or unable to cool down your body temperature.
The people who need to seek attention are usually the extremes of age, maybe the very young, the very old, those who have coexisting medical problems. A lot of people that we see in the hospital with, heat-related illness or that get pretty severe are those who are on medications and simple drugs like antihistamines.
Some of you might be worried about going to a hospital in the midst of the COVID-19 crisis. But Dr. Lavecchio wants to assure you, the staffs at his hospitals are taking every precaution to ensure the virus doesn't spread.
In the hospital, people are always worried about getting coronavirus if they just walk in. Although it is a real fear, we take a lot of precautions to avoid that. If we see a patient who has a cough, we clean up that room meticulously and then we wait a while to let anyone else go back in the room. And we like to place those patients in rooms with negative pressure.
Lastly, the doctor says not all heat-related illnesses result in a hospital visit.
If you have heat cramps, which means you're outside, maybe working, running, and your legs are a little sore, we know that rest and hydration kind of resolve that.
Even though there's a statewide stay-at-home order, some people might be trying to beat this heat by going to the lakes or going up north. Dr. Lavecchio says, of course, during this time, it's best to avoid large crowds and to minimize as much exposure as you can. Now, back to you in the studio.